Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Real glad that you could join us for another segment. In this segment, we're going to be having a conversation with Jeff Ruby, founder and CEO of Newtopia. He's joining us on the program to talk about his perspective on why both telehealth and value-based models are set to gain some pretty good ground here in the United States. Welcome to Health Professional Radio, Jeff Ruby. Thanks.
So great to be here, Neil. Wonderful to spend some time with you.
Great. Well, I, of course, mentioned that you're founder and CEO of Newtopia. Give us a brief look into your professional background and then talk about Newtopia's goal.
Yeah, sure. So I've been innovating in the disease prevention space for just about 20 years now across 4 different startups that I've been a founder of. And I got the bug a bit accidentally. I lost my dad to cancer at a young age and came to this realization that what we call healthcare doesn't have a whole lot to do with keeping healthy people healthy. And I was just struck by how backward just the whole sick care system that we live in seems, and really wanted to do something about it. And Newtopia is really a huge effort on that journey. What we are is a tech-enabled habit change provider, really focused on keeping people healthy, preventing disease, and our focus is on whole person care. And so what we want to do is really prevent, reverse, and slow the progression of chronic disease while helping to enrich mental health, resilience, individuals' performance, and ultimately reduce the cost of care for health insurers.
Now, something jumped out at me, that Newtopia is a habit change a provider. Are you saying that better health outcomes through changing of our habits is the goal?
Yeah, it's precisely what I'm saying. I think there's a tremendous amount of stock that should and isn't put in our daily behaviors and the habits that we do or the choices that we have and the habits that we adopt really around areas of nutrition, around exercise, around mental and behavioral health. And it's really the primary prevention side of how we live each and every day and the choices that we make. And we found that by focusing on habit change and focusing on healthy habit change around meeting people where they are and building those healthy habits around nutrition, around exercise, and around mental and behavioral health, we've been able to not only have dramatic impacts across physical health measures, things like weight or waist circumference or blood pressure or blood glucose, but also around mental and emotional health. And so we found that this whole health movement that I was referring to is really eliminating the line between what has been generally separate. This idea that physical health is on one side, mental and emotional health is on the other side. We just believe that there's one health, and by focusing on habit change, we can accomplish fantastic outcomes that not only reduce risks and keep people healthy, but also significantly save health insurers in healthcare costs.
You said that you discovered how as you say, backwards the healthcare system is. Each and every discipline that you named has a specialist, nutrition, mental health. They all have specialists. Do they not want us to change our habits?
Oh, I would say the intentions are absolutely well and good. Mm-hmm. I'd say the challenge is that it's very siloed. You're right. There are lots of specialists. And they're incredibly well-trained and incredibly knowledgeable. But what they tend to focus on is dispelling advice, telling people what to do, telling people what to eat, prescribing a medication, or maybe prescribing a certain action. But none of those specialists are particularly focused on behavior change and really spending the time with each individual to get to know them incredibly well, and then build up those new incremental habits and ultimately build people's confidence so that the individual becomes the engine of their own growth. That is not something that I would say the existing health infrastructure or the sick care infrastructure does particularly well. And we saw an opening and an opportunity for a habit change provider to come in and focus there. And so just as there are specialists across the various areas that are absolutely required, so too does another specialist have to serve really all of them in helping how do we enact that behavior change? How do we make sure that the recommendations being provided by the various specialists turns into real change for individuals in their daily lives, and that ultimately those changes can lead to outcomes that grow.
Has this COVID-19 pandemic revealed some of the backwardness that you saw early on? Has some of it now been revealed mainstream as a result of this pandemic?
Yeah, wow, Neil, I think it's been like such a tremendous lightning strike, one that in our lifetimes we haven't seen before. And I'd say it's really revealed it in three ways. COVID-19, for the first time in our lifetimes, the entire planet is focused on preventing a disease. In this case, it's an infectious disease, but the focus on prevention has never been so apparent. And I think it's really important, and it is hopefully a productive step forward. Number two, all of the clinical literature suggests that there's a massive connection between COVID-19 and these risk factors. If you take age out of the equation, the second most important and consequential risk factor is around weight. And overweight, obesity, and then pre-chronic disease risk. And so I would say there's a clear and shining light there. But then the third major consequence is actually what I believe takes place after COVID-19. And if you look at 1 up to 2 years of what has become very sedentary lifestyle, socially distanced, a lot of stress eating and just lousy eating as we've been stressed out at home with huge mental health issues, it's the tinder for weight gain, it's the tinder for chronic disease risk, and it's the tinder for what I believe is going to be a tsunami of increased obesity, diabetes, and heart disease that follows this.
Telehealth, we've all heard the back and forth about sitting on the couch watching TV. People aren't going to the doctor for their chronic conditions as they were before the pandemic. People aren't getting tested for this, that, or the other as they were before the pandemic. And now we're going to be sitting in front of a screen to conduct healthcare.
Well, I certainly think the genie's out of the bottle with regard to telehealth in a lot of positive ways. I think individuals have realized that there's a tremendous convenience factor, and there are a tremendous number of things that can be accomplished through a teleconversation, whether that's by video or by phone, or even in some cases by messaging and instant messaging that are going on between health professionals, physicians, and health professionals and individuals, which I think is incredibly positive. That being said, it can't be the extent of the entire relationship. There are certain tests, there are certain procedures that just need to be done in person. And yes, I think there's a big concern about what's hiding underneath, and just what, the number of diagnostic tests, the number of cancer diagnoses and or procedures to help minimize those impacts that have been, really brought down as a result of COVID-19, that is troubling. And so I think it's really the healthy combination of where we just talk about health, and there'll be a physical component to it, and there'll be a virtual component to it. I don't think there has to be such a strong dividing line in many other industries, whether you look at banking or elsewhere. Mm-hmm. Some people go in and do things in person. Other people will use an ATM or their app, and it's just called banking. And I think health is going to head the same way. And I do believe that there's a tremendous value to telehealth. The hope, though, is that it doesn't just focus on the sick care part. Neil, that there's still a focus on the habit change and the working earlier to really prevent issues before they become issues that require traditional sick care services.
Do all of our, bad habits have to do with our diet, our exercise, our mental health, that sort of thing? Or are some of our habits related to trusting in certain systems, the medical system? And as a provider, surely you've dealt with insurance companies. Are you seeing an adoption of your ideas, or a resistance to habit change from some of the big players in the healthcare game?
So I think just as a starting point, you raised a really important point, which is I think it's important to really see where the foundation of our behavior comes from. It's largely just who we are as individuals. There's a genetic component, there's a social determinants of health component, And then, of course, there's just our lifestyle and the decisions we make every day and how we're impacted. And what Newtopia is trying to do is very much grab from each of those areas and really understand where an individual is at, both from all three of those component areas to ultimately create a plan to change those habits. So I think that's really an important step. And I also think it's important to note that there's this misnomer and belief that habits are impossible to change. People don't change. And I think we just need to look no further than what's happened over the last year in our lives, and all of the changes to our habits. They may not have been positive, but boy, we've all changed our habits in a significant way as a result of COVID. So habit change is incredibly possible. I would say the response to what Newtopia has been doing has been incredibly positive from a lot of the innovators in the market who we've been working with, both insurance companies and health insurers like self-insured employers who have been looking for an alternative and looking for a method that's proven and that also is value-based, that's very much that goes at risk to make sure that we're a partner in the outcome and the creation of value for both the individual and for the insurer. And I think when you get those two pieces together, the right proof and then the right model, I think there's an opportunity for broader adoption.
Jeff, give us a website where we can learn more about Newtopia and about habit change.
Yeah, certainly. www.newtopia.com is the website. And there's an opportunity to learn a little bit more about habit change and what we do as a habit change provider. And we'd be delighted to speak with the health insurers out there about how we can help to really improve the health of your employees or members and ultimately prevent an awful lot of chronic disease and most importantly, save an awful lot of preventable healthcare costs.
Well, Jeff, I really appreciate you joining us here on Health Professional Radio. It's been a very interesting conversation. Thank you so much.
Thank you for having me, Neil. Have a great day.
You as well. You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Jeff Ruby, founder and CEO of Newtopia. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download it, SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.